viewers and listeners. I'm Manara Khan, and on today's COVID 19 update, we tell you how long it takes for you to become exposed to the COVID 19 virus.
The total number of imported cases remain at 53, and it has been that way for a while now. As you know, our protocol has been that anyone traveling to Guyana is required to have a PCR test. And if your PCR is negative, then you're allowed to travel to Guyana. And if you got the PCR within the last 72 hours, then upon arrival, we allow you to go without the need for quarantine. If it's within 72 hours to 5 days, so between 3 to 5 days, then you're required upon arrival to have a second PCR test done here at the airport. And while you wait for that test, you're asked to isolate. If it comes back positive, then you would be required to isolate for approximately 10 days. And once you're negative after that, or you don't have any signs and symptoms, then you'll be discharged from isolation. So that has been the protocol that we are following. We are currently reviewing our protocol, and we have a team that is currently reviewing that based on people now getting vaccinated, and to see how we can do both PCR and vaccination as a requirement.
Okay.
So that's something that is currently being worked upon. There's only one gold standard, and that's PCR. And that's what we are using. In the United States, they accept PCR and they accept antigen tests. For our purposes, we are not accepting antigens here in Guyana. The reason being is that antigen testing, they're not as sensitive as the PCR. PCR, if somebody is positive, you can know within a shorter period of time. But with antigen, it takes a long time. People generally would have to be symptomatic before you see a positive results. So as of yesterday, we've had 242,991 persons who would have received their first dose of their vaccine. That is approximately 49.9% of our adult population. So we're a little bit short of that 50% mark. For second dose, we are at 128,252 persons. That's approximately 26.3% of our adult population. Early in the pandemic, with the original strain of the virus, one of the requirements of the WHO to say that a person has been exposed is for a person to be in close proximity with somebody who has COVID-19 and who would spend at least 15 minutes with them, so that you will then deem that person to be exposed. Things have changed since then, and what we have now is several variants of concern that are more transmissible, more infectious. So we have the alpha variant, we have the beta variant, we have gamma, we have delta. All of these different types of variants are more infectious. So with the latest one, with the delta variant, you don't have to wait 10 minutes in a room with somebody to be deemed to be exposed, because this one is highly transmissible. And therefore, people ought to be cautious. So a number of things can affect whether you contract the virus or not. the distance that you're, how far are you away from the person that is infected? 2, whether you're wearing mask and whether you're wearing it correctly. 3, whether you're in an enclosed or an outdoor environment. All these things and the duration of time that you spend next to the person. All these things would have a direct bearing on whether you can contract the disease or not.
That's it for our COVID-19 update. For more information, visit health.gov.gy or our website dpi.gov.gy and our social media platforms.